Hello, my name is H. Daniel Zegzula. I'm a board certified plastic surgeon practicing in Portland, Oregon. I've been in Portland, Oregon for a long time. I've been practicing for 25 years. Actually, this will be 27 years. I started practicing in 1999, believe it or not. But we first moved to Oregon in 1991 when I came to Portland to train in general surgery at the Oregon Health Sciences University. And I trained there, got a complete training in general surgery. And then after general surgery, moved to Boston for plastic surgery training. And I did my plastic surgery training at Harvard, specifically at the Massachusetts General Hospital, although we traveled around a little bit within the hospital, the Harvard hospital systems there. But when I finished in Harvard, I really enjoyed my time in Portland, and we have some family in the Portland area, or the West Coast, Northwest Coast. So we came back to Portland, and I've been practicing here since then. Training is one thing that every patient can verify or research about their surgeon even before going to have their consult. Their credentials should easily be found online on their website. And if it's not on their website, you can go to other sources online to see if they're board certified. And I think board certification is an extremely important qualification to look for in a plastic surgeon. But what you need to really look for is that your surgeon is board certified by the American Board of Plastic Surgery. Because a cosmetic surgeon, someone who says they're a board certified cosmetic surgeon, may be leading you astray. There is no board of cosmetic surgery that's recognized by the American board specialties, like all of the big specialties in medicine, internal medicine, gynecology, obstetrics, psychiatry, surgery. They all have American Board of in front of their name. And cosmetic surgeons have this other little weird board that they made to get the name. And you can be just a general surgeon with no plastic surgery training. You can be a dermatologist. You could be a family doctor and take some training through them and then call yourself a board certified cosmetic surgeon. And the degree of training between these two different credentials is night and day. The American Board of Plastic Surgery is a strenuous process, strenuous testing, and a continuous education. Every year, we're doing more and more education to maintain our certifications. And those are very important things when you're choosing a surgeon. So I think training is verifiable, easily done before you see your surgeon. And a very good advice would be to check out the credentials and the training of your surgeon, because it makes a world of difference. The procedure you're looking for, whether it's breast or body contouring, whether it's facial surgery, it's important to say, how often do you do this procedure? Are you comfortable doing this procedure? I think that's an important question. If they're doing something on a weekly to monthly basis, the same procedure, that's a good number. Because maybe I don't do a circumferential abdominoplasty every week, but I certainly do one every month, and I feel like I'm good at those operations. And so I think operations that you're doing at least monthly, if not weekly, those are operations that you're going to be really good at. Procedures that you're doing once or twice a year, depending on the surgeon and how long they've been doing it and how close that operation is to similar operations that they do frequently, that also might be okay. But if your surgeon says, yeah, I hardly ever do that, or yeah, I've only done a couple of those, it should give you pause to think about, is this the right surgeon to be doing this surgery? And it doesn't mean absolutely not, but get into a deeper discussion about, well, what surgeries are like this? And when you've done these surgeries, what were the results like? Were you happy with your results? Was the patient happy with the results? I think all of those questions and answers help build the relationship between you and your potential surgeon. And I think you both should be comfortable with these operative or the surgical plan before starting into this relationship and this kind of, you're going to be seeing the surgeon for months in your recovery, and you're going to invest a lot into this. And I think doing the work up front is really important. 27 years, a long time. I can easily tell them hundreds to thousands. And I feel very comfortable saying that number. And especially when it comes to breast surgery. I mean, thousands of implants, thousands of breasts operated on. And so those are easy numbers to throw out. But of course, within breast surgery, there's always little nuances. Have you ever done your breast lift this way? Have you ever used this implant before? And then you can kind of get into the minutia with them. But yeah, that's how I answer honestly, but it's at this point in my career, it's thousands for most procedures. I like it when my patients come to the consultation and say, yeah, I looked you up online. I saw that you trained here. And I always think, now this is a patient who's done some homework. This is a patient who's ready for this consult. So I like it when they tell me that they've done some research before sitting down to talk with me. I like it when they ask me what my favorite procedure is. I like it when they ask me how many numbers I've done, or even sometimes, what is the worst complication you've seen from this operation? Those can be scary questions. And I sometimes tell them, hey, the worst potential complication is pretty scary to talk about. But if you want to talk about, this is what it is. And I'll tell them how many times I've seen it. Those are questions that tell me that the patient's ready to have a really good consult and learn a lot. And by the way, I start almost every consult with, did somebody send you to see me? Were you referred by a friend or a doctor? Almost every one of my consults, I'll start with that. And it used to be the most common was patient referral. So a friend or a relative who I was their surgeon, or a physician, primary care doctors or OBGYNs most commonly. But now the most common answer is, oh, I found you online. And then I joke with them and say, oh, Dr. Google referred you. And they'll say, yes, Dr. Google referred me. So a lot of patients' journey in our office begins with a phone call. And although sometimes that might be with a receptionist, more often it'll be with our scheduler or our patient care coordinators. And they will get into a conversation with you about, what are you looking for? What procedure are you interested in? Getting some basic information, getting some information about the procedure, about the surgeon that they're going to be seeing, and sometimes even a little heads up as to the costs involved in some of these procedures, just so people aren't surprised. And then they'll get a consultation date. They'll show up at the office. And of course, the first person you see then would be the reception team. And we have a couple of receptionists behind the desk, and they'll warmly greet you to the office and likely have a little bit of paperwork for you guys to fill out, unless you've done that online. And it's always great when patients do that online before coming to the office. And then one of our medical assistants will greet you. They'll meet you in the reception area and escort you to an exam room and get some more information. And then I'll come in and say hi and ask what brings you to see us today and who sent you. And then we'll get into a nice conversation about what you're looking for, what your goals are. And many times I don't ask them what procedure they want. I'll ask, what are your goals? What are you looking to achieve? And then we can talk about procedures that will help you achieve those goals. By the time you've met me, you've already likely had a conversation with a patient scheduler and the receptionist and the medical assistant, maybe one of the nurses. Then you'll get to see me. And if we've talked about a surgery and you're requesting a quote, a price quote for what that costs, then you will face-to-face meet our patient care coordinators, and they'll go over a price quote with you. And from there, it's up to the patient to decide if they want to book surgery and how to go from there. I usually take clinical photography at the end of the first consultation. It's not a requirement by any means, but by that point, most patients know what procedure they're thinking about, and we've come up with a plan, and therefore it makes sense to get the photographs done so we don't have to worry about getting that at the preoperative visit. Occasionally, patients don't want to do that, and that's perfectly fine. I do like to have preoperative and postoperative photographs on my patients. It helps us looking at these procedures to go over the results with patients post-op. It's always helpful to see if there's anything we might have changed, what particularly worked well. And I think patients get a bit of enjoyment having access to those photographs. And all the photography done in our office is always available to the patients online. They can have access to their entire portfolio of photography. I do think during these consultations, it is a two-way street. For sure, the patient's wondering, is this a good fit for me? But you better believe that the surgeon is doing the same thing. Is this patient going to be a good fit for my practice? And occasionally, I will tell patients that I don't think I can offer the surgery that they're looking for. It doesn't happen a lot, honestly, but sometimes if a surgeon tells you no, you should really, rather than getting your feelings hurt, really take a step back and wonder, why did they say no? And they usually would explain, I'm saying no because I don't think I can do the operation you're looking for. In my practice, probably the most common scenario where I might tell a patient, no, I don't think I can help you, is if the procedure that they're asking for is too extreme. And the best example would be an implant that just would not fit in that patient's breast. I have occasionally, and not too often, have had patients request an implant size that I don't think is safe. And if can be done safely, but what will it look like in 2 years' time, 5 years' time, 10 years' time? Because I think implants that are too big are most likely to have complications and most likely to have unhappy patients long term. So occasionally I'll say no. There's usually a good explanation, and I'm really trying to guide the patient to a better decision, because that original choice, the original desire, might not be a realistic accomplishment. We have a website located at www.portlandplasticsurgerygroup.com, and you can request a consultation online for myself or for any of the other providers, including the estheticians and the nurse injectors. And then someone would reach out to actually give you a time and a day. If you don't have access to the website, then you can always make a phone call, and we're at area code 503-292-9200. And you have to go through the phone tree a little bit, but you would ask for a reception and they can get you an appointment. I'm happy to do an online consultation with people who are out of town or a long drive away. We likely would get some information first, what you're looking for, and maybe even some photographs. That can be very helpful to have a more accurate consultation experience. But yeah, we're very happy to do online consultations for patients who are at a distance. Yeah, I think they work really well.